Addressing PTSD and caregivers of pediatric cancer patients. Community. Community is the tie that binds all of humanity together. Without it, we are nothing. Some common places people find community is within church or spiritual organizations, volunteer organizations, or within the workplace. Unfortunately, a common thing many people experience is trauma. According to the National Library of Medicine, 70% of people say they have experienced trauma. Trauma can look like many things, but it can also come from many different experiences. Some experiences that can be traumatic include sexual assault, physical or verbal abuse, or homelessness. Former South African leader Nelson Mandela, in response to how he and his prison mates overcame the trauma of prison, said, "We supported each other and gained strength from each other. Whatever we knew, whatever we learned, we shared. And by sharing, we multiplied whatever courage we had individually." Mandela's statement is a testament to the power of community in overcoming trauma. A trauma that many families experience is the diagnosis of their child with a severe illness such as multiple sclerosis or cancer. Every year, there are 15,590 children diagnosed with cancer. Of that, 1,780 will die, making cancer the second leading cause of death among adolescents and children. While chemotherapy or partaking in a clinical trial is necessary in the suppression of cancer, it does not come without its side effects. Some side effects of chemotherapy include nausea or vomiting, body aches, or cognitive impairments. By law, a child cannot receive chemotherapy without an adult. And while the adult may not experience the physical ailments of the chemotherapy treatment, they too have to face the harsh realities of cancer treatment. Some barriers that caregivers face are logistical barriers. Hospitals are not located within the urban areas, and they're more located in the central business districts, so people have to travel to get to the hospitals. That brings us to our second barrier, financial barriers. With increased travel and commute times comes the use of lots of gas, which can add up quickly. And the cost of chemotherapy is not cheap, ranging up to $48,000 a year. Also, emotional barriers. No parent is ever fully equipped to watch their child suffer through the effects of chemotherapy. According to Ulrika Poder, a professor at the Department of Health Sciences at the University of Sweden, 68% of mothers and 57% of fathers say they've been diagnosed with PTSS, or post-traumatic stress syndrome, while 44% say they've been diagnosed with post-traumatic stress disorder, PTSD, after they're watching their child undergo cancer treatment. According to Larry Mullins, a professor of psychology at Oklahoma State University, a parent's mental health is directly correlated to the success of the child's cancer treatment. So if a parent is struggling with their mental health, the likelihood of their child's cancer treatment working decreases. So, what is the best way to combat PTSD of caregivers of pediatric cancer patients? Solutions to combat caregiver PTSD: spirituality and psychoeducational therapy. Spirituality has both physical and psychological benefits. According to Attila Brown, a registered clinical psychologist, those who have greater spiritual involvement are less likely to have high blood pressure or die of stroke or heart disease. And according to David O. Stern, a psychologist specializing in the treatment and research of anxiety disorders, those spirituality is recognized as a good way of coping with trauma. Some limitations to spirituality are they're difficult to join. There are so many different spiritual organizations, and some require that you have a familial aspect involved, which can make it difficult to choose which one is right for you. Also difficult to follow through. Many religions and organizations require a weekly meeting, or sometimes even more than that, and that can be difficult to mitigate whenever you have to go to all these appointments for chemotherapy. Therapy. Now, I know what you're thinking when I say therapy. You lay down on the couch and you tell everyone your problems while they psychoanalyze you. Probably looks something like this. But in reality, therapy looks more like this. Therapy is the unwinding of the thought of your maladaptive thoughts. It helps you process trauma, grief, and other mental ailments. While there are many types of therapies, I'm going to talk about two today. Cognitive behavioral therapy. Cognitive behavioral therapy, in a session you would tell a clinician your distorted thought, and they would help you by giving you coping mechanisms to deal with this thought. Some limitations to cognitive behavioral therapy are it's too expensive. It can take up to 15 sessions of cognitive behavioral therapy to work, and each session costs about $150 without insurance, which can add up pretty quickly. It's also too broad. While it does reach the negative thoughts that you have, it doesn't necessarily reach the whole problem. Group therapy. Group therapy provides a community. In group therapy, you sit and you talk with people who are experiencing the same thing you have or who have the same mental ailments you do. It also provides affordable care. Since the clinician to patient ratio is higher, the care is spread out between all of the different people receiving the therapy, so it's more affordable. It also provides stability. Typically, group therapy appointments occur on the same day, same week, same month, and they're easy to schedule around for if you have to go to chemotherapy appointments. Some drawbacks to group therapy are there's more room for criticism. When you open up yourself to somebody else, there's always room for them to criticize you, which can complicate your recovery journey. And it's also, you're more reliant on the therapist. And since there's only one therapist in a group of people, this therapist has the possibility to be very charismatic and possibly overbearing, which can also compromise your recovery journey. So what is the best solution to pick? Group therapy coupled with spirituality.
Thank you. Jay, how did you approach and synthesize the differing perspectives in order to reach a conclusion?
Well, there's a lot of different types of therapy. Even in cognitive behavioral therapy, there's prolonged exposure therapy and mere exposure therapy. And I did a lot of research to figure out which one was the best for specifically treating people that have undergone watching children go through cancer treatments. And so I supported the group therapy along with spirituality.
Okay. And what additional questions emerged from your research? Why are those questions important?
I just talked about cancer in my presentation, and I know there are other major illnesses that children deal with, and I would like to learn about how these treatments apply to those illnesses as well and how people recover from that.
Okay. Thank you very much.